Hello, my name is Devon Benson and I'm a senior athletic training student at Florida Gulf Coast University, and today I will be demonstrating how to conduct a SCAT5 concussion assessment. So the SCAT5 is usually used for immediate or on-the-field assessment. Right when an athlete goes down, you want to check out the red flags. So those could be neck pain or tenderness, double vision, weakness or tingling, burning in the legs or arms, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, increasingly restless, agitated or combative. And I forgot to introduce my classmate Rob. He will be the athlete today. Step 2 of the SCAT5, you go on to observable signs. So you want to see if the athlete is lying motionless on the playing surface, if their balance is off, or if they're having any gait difficulties or motor incoordination, such as stumbling, slow, labored movements, disorientation or confusion, or the inability to respond appropriately to questions, or a blank or vacant look, and then any kind of facial injury or after the head trauma. After all those check-off is clear, then we would move into the memory assessment or Maddox questions. So I would ask Rob, what venue are we at today, or which half is it now, or who scored last in the match, what team did you play last week, and did your team win the last game? So Rob, did your team win the last game?
No, we got destroyed.
No, I'm pretty sure y'all won, so
he
might be concussed. So after the Maddox questions, we move into the Glasgow Coma Scale. So there's 3 different categories for the Glasgow Coma Scale: eye response, verbal response, and motor response. The eye response is based on a 1 to 4. The verbal and motor is based on a 1 to 5. And then the motor is based on a 1 to 6. The key for the Glasgow Coma Scale is you want to have your athlete score the highest possible score. So for the eye response, they would score a 1 if their eyes were not opening to any stimuli. They would score a 2 if their eyes were opening in response to pain. So if I pinched his neck and then his eyes opened, then he would get a 2 for that. And then if I was talking to Rob, like, hey Rob, and he opened his eyes to the speech, then he would get a 3. And then if he opened spontaneously through any stimuli, he would get a 4. Then for the verbal response, if he has no verbal response, he would get a 1. If he was saying incomprehensible sounds such as like grunting or words that you can't really make out, he would get a 2. If he was yelling any inappropriate words or curse words, then he would get a 3, because that would show that he's in pain. If he was confused but he had good speech, then he would get a 4. And then if he was well oriented and knew what was going on, then he would get a 5. And then for the motor response, if he wasn't moving, he would get a 1. If he extended the pain, so if I pinched his arm and then he extended, then he would get a 2. If I pinched him and then he had abnormal flexion to the pin, then he would get a 3. And then if I pinched him and he withdrew from the pin, he would get a 4. And then if he could localize the pain, such as if I pinched him on the forearm and he knew it was on his forearm, he would get a 5. And then if he obeyed all commands, such as stand up or roll over, whatever it may be, he would get a 6. So after that, you would add up all the categories, and then you would use that for your final decision-making process. For the cervical spine assessment, the athlete, if they report that their neck is pain-free at rest, then that would be a good thing, because if they weren't pain-free, that would be one of those red flag signs that you need to get them taken care of. And then if there was no pain at rest, then does the athlete have full active range of motion of the head and the neck? If he does, then that's good. If he doesn't, then you got to get that taken care of. And then is the limb strength and sensation normal? So that would be anything from the dermatomes to the manual muscle testing for the head and the neck. And then we would move on to step 3, cognitive screening. I would ask him some orientation questions. So Rob, what month is it?
What month it is? I don't know.
He doesn't know, so he would get a 0 for that. And then what is the date today?
The date today, I think it's like, what, the 30th, 31st?
Yeah, alright, so he would get a 1 for that. And then what is the day of the week?
Day of the week, it is a Thursday.
Alright, and then what year is it?
2018.
Alright, and then what time is it right now?
Probably like 9, 10 o'clock.
Alright, so then he would count those up and base his score out of the 5. And then I would go into immediate memory, so I'm going to give you a list of words, and if you can repeat them back to me.
Okay.
So, baby, monkey, perfume, sunset, iron.
Baby, monkey, perfume, sunset, iron.
Alright, and then we would repeat that 3 times to get a sufficient score out of 15. And then if he was able to do that, we would move on to the 10-word list, and then we would move on to concentration. So I'm going to give you a list of numbers, and I want you to repeat them back to me backwards, so in reverse order. So 493.
394.
Alright, we would move on to the next list. 526.
625.
Alright, and then 142.
241.
Alright, and then he checked clear for that one, so we would move on to 4 digits and then 5 digits, and if he checked clear off that, then that would be a solid 4 out of 4 for the concentration portion of the SCAT5. And then we're going to move into months in reverse order, so Rob, can you give me the months in reverse order?
Okay, let's try this. So, December, November, October, September, August, July, June, May, April, March, February, January.
Alright, so we did good on that one. We would then combine his digit backwards score and his months in reverse order and add them up and score that out of 5. So then we would move on to step 4, the neurological screening. So if the patient can read aloud and follow instructions without difficulty. So Rob, can you read that cereal box up there?
Oreos.
And then, so he followed my instructions and read aloud the correct word. And then we moved on to, does the patient have full range of pain-free passive cervical movement? So he would be resting, and I would be passively moving his cervical spine, lateral flexion, extension, and flexion, and rotation. If it was pain-free, then he would check off as yes for that one. And then, without moving their head or neck, can the patient look side to side and up and down? So I would have Rob face me, and then I would have him, without moving his head or neck, look to the right, or to the left, and then up and down. Alright, so he can do that without any dizziness or double vision. So he checks off for that. And then, can the patient perform the finger to nose coordination test normally? So I'll have Rob point his finger out and bring his finger to his nose with his eyes closed.
Okay, so make sure this one's in the camera, so here.
Alright, so we did good for that one. And then, can the patient perform tandem gait normally? So what we would do is have his non-dominant foot in the back and his dominant foot in the front, and see if he was unbalanced or uncoordinated. And if he was, then he would check off as no, and if he had good balance, he would check out as yes. So then we would move into the balance examination. We would record which foot we were going to test, and then we would also write down what kind of footwear Rob is wearing and what kind of testing surface we're on. So we would do double leg stance, single leg stance, tandem stance. Double leg is just standing with 2 legs. Single leg is 1 leg, and then you would do both sides. And then tandem would be 1 foot in front of the other. And if you see any errors, you would write those down. And then this takes us to step 5, delayed recall. So the 5 words that I told you earlier, can you repeat them back to me?
No.
So he can't repeat them back, so that would be a 0 out of 5. And if he couldn't repeat the 10 words back, he would get a 0 out of 10. And then our decision-making process, we would tally up the number of symptoms that he has out of 22. If he gets like an 18 out of 22, he probably has a concussion. And then we would move on to the severity score, which is out of 132. And then we would add up the orientation points out of 5. So those were the questions like what venue are we at, or what day of the week is it. And then his immediate memory was his immediate memory was the words that I told him to remember. And then we move on to concentration, which is the digits that I told him to go backwards in. We would tally all those up. And then the neuro exam, if it was normal or abnormal, we would determine that. And then we would count up his balance errors and his delayed recall. And then pretty much based on what you see on the decision-making process is it's gonna pop out to you if he has a concussion. If it's really close, then you automatically assume that he has a concussion, and then you date the time of the injury and whether they've had a concussion before, and if you're gonna diagnose them with a concussion. And then you can also retest the athlete if you would like. And then you need a physician signature for the athlete to return to play. I hope this video was informational, and thank you for watching.